Welcome to Living Aligned. I'm Andromeda Stevens, your scoliosis coach. Today we're going to be talking about early detection of scoliosis in children. So if you are thinking possibly that there's something going on with your child, whether you see that their shoulders are a little unlevel, or maybe a hip is popping out, or when they lean over to touch their toes that you're seeing a little bump or something, I never call it a hump. Scoliosis, when detected early, is quite manageable. So it's important to get evaluated right away. If you're seeing something that looks a little off, you can certainly do some measurements on your own. This is a very simple device that you can buy on Amazon. This is called a scoliometer. There are apps on your phone that you can use. I don't love those because they don't have this little cutout, and the little cutout is designed to go along the spine. And without the cutout, if you're using just a phone, it tends to sort of teeter-totter and you're not going to get a good reading. So these are not expensive on Amazon. A scoliometer, get the cheapest one you can. They pretty much all do the same thing. And there are videos on YouTube all over the place about how to use these. I have one on my ScoliosisCoach channel, and you can check your child to see if you're finding a little rotation. Rotation is a pretty good indicator that there is some sort of lateral curvature going on in the spine. And if the curvature that you're measuring, the rotation rather, is about 5 degrees or more, that's something that you want to get activated on. Go to your pediatrician, go to your doctor, and get an x-ray taken. There are many ways to get x-rays taken. It's important to make a good decision for your family. So do a little research. There are low-dose x-rays that are optional, depending on your location. You might want to look into something called an EOS, or a microdose x-ray, to get evaluated and have that curve measured right away. Early detection is key. You have options, you have bracing options, you have physical therapy options. You don't have to run to surgery. Surgery should be reserved for somebody who is in terrible pain. The curve is progressing rapidly. The curve is unmanageable. Or perhaps it's a congenital issue that cannot be remedied with physical therapy or with bracing. So it's important to not watch and wait. This is my key piece of information for you. Watching and waiting is a disaster. I did have a young client. I think she was about 13, a little ballerina, a professional ballerina, really going somewhere in her career. And her mother noticed a little something going on with her and was not quite sure. So she brought her in, and we just detected a very small rotation, about 5 degrees of rotation, but we got her an x-ray, and lo and behold, she had a 29-degree curvature in her low back, which is a significant number. That's a moderate scoliosis. So she started treatment right away. She got a brace. We started doing Schroth physical therapy with her. And within a matter of months, that lumbar curve was down to 14 degrees. So this is a highlight of how important early detection and management is really important for your child. Now's the part where we talk about the misconceptions and myth busting with scoliosis. And one of the common misconceptions and one of the scariest things that can happen to you or to your child is going to the orthopedist and being told, well, the scoliosis is really big. You're going to have surgery. We have to start talking about a surgical date. And you're like, whoa, okay. This is a lot to digest. You're learning that you have scoliosis maybe for the first time, and now you're immediately talking about surgery. Of course, surgery has its place and its time and its function in scoliosis care when a curve is very large, or it's unmanageable, or it's progressing quickly, or it's very painful. Surgery can be an amazing option, and there are surgical techniques these days that are just off the charts. Astounding achievements in surgical intervention, but you don't have to go there as your first option. Bracing for scoliosis has been shown in the research to have astonishing results when combined with physical therapy, such as something like Schroth, or something that we also call scoliosis-specific postural exercise. That's a lot of words. But for Schroth physical therapy and bracing combined, you can get some amazing results. And this can happen in a matter of months, hopefully in a matter of a couple of years. Not everybody needs full-time bracing. It really depends on your case. And there are different kinds of braces out there. So you need to do your research. You certainly wouldn't buy the first car that you just walked up to. You don't even buy the first cell phone that you look at. You do your research, right? You check out every single option that's available to you. How much memory do I need? What size of camera do I want? Like, hello, there are options. So this is America. We have millions of doctors, millions of types of braces out there on the landscape. So find out what's going to work best for you and for your family. Thank you so much for joining us today. I'm so passionate about this topic. Please join us for our next episode, which talks about postural awareness.